Hey there. Let's be real. Getting older changes everything in our body. But one part most men don't really talk about is the penis. Yep, it goes through its own changes after 50, and some of them might surprise you. Today we're looking at the shocking changes that happen to the penis after 50, what's normal, and when you should see a doctor. 1. Size shrink surprise. One of the first changes men notice is shrinkage. The penis can actually lose about half an inch to a full inch in length as you age. This isn't because it's broken. It's usually due to less blood flow and tissue changes. Even the testicles can shrink a little. It's normal, but keeping healthy blood circulation through exercise can help slow this down. 2. Erection takes longer. Another big change. Erections aren't as quick or as firm as they used to be. The reason? Blood flow slows down with age, and testosterone levels dip too. This doesn't mean you can't have a healthy sex life. It just means patience and stimulation matter more. Sometimes lifestyle changes, like cutting back on alcohol or smoking, can make a big difference. 3. Sensitivity drops. After 50, many men feel less sensation in the penis. The nerve endings just aren't as sharp as before. That can make reaching orgasm take longer, or sometimes feel less intense. But here's the good news. This can also mean longer-lasting performance, which some partners actually enjoy. 4. Color and shape changes. You might notice the penis looking a little different in color or shape. With age, the skin can get thinner, and veins may appear more visible. Some men even see a slight curve develop, called Peyronie's disease. Most of these changes are harmless, but if you ever see pain or sudden bending, that's worth checking with a doctor. 5. Testosterone decline. By age 50, testosterone levels are usually much lower than in your 20s or 30s. This hormone is key for sex drive, energy, and even mood. Lower testosterone can affect erections and desire, but it also impacts muscle mass and sleep. A doctor can check your levels and see if treatment is needed. 6. More bathroom breaks. Here's something men don't expect. Your penis is linked to your prostate health. After 50, the prostate can grow, making bathroom trips more frequent, especially at night. This doesn't always mean cancer. It's often just an enlarged prostate. But still, regular checkups are important, because catching issues early makes a big difference. So those are the shocking but normal changes your penis goes through after 50. Some of them sound scary, but most are just part of aging. And the good news is a healthy lifestyle and regular checkups can keep things working longer than you think. If you found this video helpful, give it a thumbs up, drop a comment below, and don't forget to subscribe for more health tips that nobody else talks about.